Well, hi, my name is Sam Iser, a neurologist here at Hennepin, and I have the pleasure of giving you the orientation for your neurology medical student clerkship. The rotation at Hennepin and in general is a bit different. It's a 4-week rotation. There are 2 weeks of inpatient neurology that will primarily occur on R5, and then there's 1 week of outpatient neurology, which will occur in the specialty clinic across the street from the emergency room. And the schedules of who you're working with can be found on Amion, which I'll go over shortly. And then the unique thing is the brain week. So everyone will do 1 week of independent study. And each medical student will do these weeks in different orders, and you will get that schedule at the beginning of your rotation. In order to find out who you're working with during your neurology clinic days, we ask you to look at Amion. You can access Amion a variety of ways, through Epic, through info on call, using the website with the password as indicated on the slide. And you'll see at the bottom of Amion there are names highlighted in yellow, and they tell you which attending you'll be working with in the morning and afternoon sessions. Similarly, there's a schedule for inpatient neurology, which can also be found on Amion. And we ask that you look for your senior resident you'll be working with, as well as your attending. And again, the Amion password is seen in the slide. The schedules for the inpatient and outpatient, we want to make this as clear and easy for you as possible. So for inpatient, we ask that you arrive around 7 o'clock. You will be expected to be present Monday through Friday, 7 to 5 p.m. with some exceptions. Each medical student will do 2 long call weekdays where between Monday and Friday you'll be asked to stay till 9 p.m. on 2 days. And then you'll be doing 1 long weekend day from 7 a.m. to 9 p.m. And your long call days will be assigned on the first day of the rotation. There is no overnight call. Patient care comes first. So in the event of a trauma or a stroke code, the times I just listed may vary. Outpatient is a little bit more structured because it's a clinic setting. And so the AM clinic starts around 8 o'clock. And so we ask that you be there around 7:30 or 7:45, and you start seeing patients at 8 o'clock. The afternoon clinic starts at 1 p.m. The first patient is at 1 p.m. and goes until 5. We ask that you eat lunch and be there around 12:45 or 12:50 so that you can start seeing the first patient. The exception is the ALS clinic, which is only on Thursday afternoon. It starts at 11:45, and so we ask that during your Thursday morning session, you ask to be excused so that you can come to the CSC conference room at 11:45 to meet the team. And bring your lunch. Some key things to know. So the inpatient bathrooms are located on R5 across from the elevators on the 5th floor. When you log in to Epic, the context we want you to use is the neurology service. To get into the neurology workroom, we ask you to use your Hennepin badge. And then there will be a conference room you'll be asked to go to on Fridays, and the door code to get in is 5445, and that's in P5 310. The outpatient clinics will occur in the CSC. The bathrooms are in the same hallway as the conference room, so if you go at the back door of the workspace, you'll see the bathrooms in that hallway. When you're seeing patients in general neurology, we ask that you log in to CSC Neurology Clinic. If you're seeing patients in the sleep center, log into Sleep Center Clinic HCMC. For the EMG session, it's CSC EMG. And when you do your Peds Neurology Clinic, please log into CSC Peds Neurology Clinic. To get into the CSC workspace, the door code is 1458. And when you do the sleep rotation on G8, the code is 5151. We do ask that you wear your white coat so that we and patients and other nurses and providers can identify you as a medical student. We really enjoy our reflex hammers, so please bring your own reflex hammer and some other tools such as a stethoscope, your tuning forks, your HCMC badge, and a way for you to take notes. So where is neurology? Hopefully you've seen that beautiful painting outside of the R5 wards. The neurology workspace is just to the right of that painting. The room number is R5 320. And again, to get in, you need to use your badge. Where are you going to see patients on the inpatient rotation? Essentially everywhere, most commonly on the STN unit, the emergency department, the surgical ICU, and perhaps places like NAP rehab. You'll also go to inpatient stroke codes, which can happen in any unit and location in the hospital. The outpatient rotation is almost all in the CSC third floor. That's where you're going to have general neurology, neuromuscular clinic, the ALS clinic, the Huntington's disease clinic, the EMG lab is on the third floor, and so is pediatric neurology. The one clinic that's an exception is the sleep clinic, which is on Green 8. So who is the inpatient team? You're going to be working with one attending at a time. There's one senior neurology resident, and their responsibility is to manage the trainees and help run the consult service. There's also a junior neurology resident, and they're responsible for running the stroke codes and primarily taking care of the stroke patients. There's always one stroke nurse practitioner, there's one stroke care coordinator, and then there are multiple other interns that are first-year residents, as well as other medical students. So there is some built-in didactics. Every Tuesday, there's a sleep center conference on G8 313. Every Friday, there's a fantastic neuroimaging conference that includes neurology, neurosurgery, neuroradiology, and that occurs in that conference room P5310. Again, the code to get in is 5445, and that's from 11:15 till noon every Friday. On the first Tuesday of every month, there's an EMG waveform conference on the third floor of the CSC, and lunch is provided for that conference. On the third Wednesday of every month, over the noon hour, there's a Huntington disease conference, also on the CSC third floor. And then, especially on the inpatient weeks, there is teaching by Dr. Bunley and or Dr. Martin with the residents. And because residents have continuity clinic, the day of the week will be different. And so please ask your neurology senior resident when that teaching will occur, but it almost always occurs during the lunch hour. There are some events at the university outside of Hennepin. So on day one of the rotation, there's going to be a clerkship kickoff where you learn how to think like a neurologist. And so please refer to Canvas for any specifics regarding those events. And when you're done, please come back to Hennepin to start your rotation. On the second Friday, you will all go back to the university to do the NESA exam, which is an opportunity for you to demonstrate your neurology examination skills and be observed by a neurologist. And I encourage you to not stress out about it too much. It's really an opportunity for you to learn how to do the exam and get expert feedback by an actual neurologist. During the Tuesday of your independent study called Brain Week, there are group activities and other assignments that you'd want to look into the Canvas for. And then, of course, on the fourth Friday, you do the neurology shelf exam, which then ends the clerkship. So a typical day in clinic. Again, please arrive around 7:30 or 7:45. Meet the attending or preceptor that you're working with. They'll go over the expectations of the day, how they want you to see patients, how they want you to write notes, and then you can begin reading about your patients. From 8 to noon is when you get to see your patients, and it might look in a variety of different ways. You may see patients on your own, or you may see patients with your preceptor. So please discuss that with your preceptor because everyone does it a little different. Before you see a follow-up patient, what I ask is that you review any previous neurology notes, any pertinent investigations, lab tests, imaging since the last visit, had they been to the hospital or the emergency room or anything else that might be pertinent, and then look at their medications. When seeing a new patient, I recommend you figure out why they were being referred and by who. And you can do so by going into chart review, looking under referral, find the name of the provider that ordered the neurology consult, and read that note from that day that they ordered it to learn more about why they're sending them to neurology. And then do your pre-chart review, looking into other past medical history, examination studies, and so that you can see the patient. And when you see the new patient, please perform a full neurologic exam so that you can present to your staff. Then eat lunch from 12 to 1, and then do it all again the same way from 1 to 5. Be prepared to write notes. Sometimes you'll be writing notes in Epic, sometimes you won't, so please again discuss that with your attending. And if you need to leave early or be gone, please let your attending know. So what does a typical day look like on the inpatient side? A little bit earlier. You come in at 7 o'clock so that you can get sign out from the overnight night float resident. Then from 7:15 to 8:45, you're going to go and see your patients that you've been assigned. So you'll read about them, chart, check, talk to their nurse, and do a complete neurologic exam. Then you all come back to the workroom at 8:45 and you present your patients to the attending. It's always a good idea to run through the assessment and plan with your senior resident beforehand if possible. And then after you talk about the patients, after rounds, the entire team will go and see the patients together. And once you're done seeing patients, that's the time for you to write notes, call consults, communicate recommendations, call caregivers or facilities or whatever's asked for you. You will usually leave at 5 p.m., but you have to remember that neurology sees patients, whether it's consults or new patients, all throughout the day, and so the time of day may vary based on the needs of the patients. Things to do before day one. Please review the supportive documents on Canvas, as listed here. It's especially important before beginning your inpatient weeks to please read the AHA stroke guidelines and then complete your own online NIH stroke scale training so that you can start doing your own NIH stroke examinations. And finally, how to succeed on neurology. Ask questions. The students that ask questions, I think, get far more out of the rotation than students that don't. Read about your patients. Read about the diseases, especially before seeing them and especially before presenting them to your senior residents and your staff. One thing that's really important for neurology is learning the neurologic exam. So I recommend asking a senior resident or a staff to observe you doing the neurologic exam or a part of it. Say, hey, can you watch me do my reflexes and give me feedback? That way you get feedback from an expert in the moment. Bring your tools, bring your reflex hammers. Ask to use other people's tools. Ask a resident to use their reflex hammer so that you know what it's like to use a real reflex hammer. Take initiative, ask to see patients, write notes, call caregivers, call teams, look up literature on patients, and help by charting. Neurology can be hard emotionally for patients and the families and the providers, so stay engaged, show that you care, show that you're here to learn. And then finally, neurology can be a lot of fun and intellectually challenging, and it shouldn't and doesn't have to be hard or scary. So welcome to the Neurology Clerkship. Please reach out if you have any questions or concerns.